Welcome, Gary.
Yes, thanks, Deb.
Let's talk numbers.
Okay, I'll give you the traditional rundown, and today I'm following up my report from a couple weeks ago with continued good news. Although that's a relative term, I did an interview with ABC 30 earlier this morning, and I was also reporting the number of COVID positive patients that are in-house, and it's a good news, bad news story. So the good news is we're down to only 50 patients. So when you think back in August when the new Delta variant arrived and we felt the onset of that fourth surge, we hit a high water mark, I think, of 130 COVID positive patients in the acute medical center, and so to be down to 50 today is certainly celebratory from that standpoint. But not so celebratory, as that still means there's 50 members of our community that are sick and they're in the hospital. Fewer and fewer requiring intensive care in the ICU and mechanical ventilation, but still that's 50 people that we hope make a full recovery and are back home in time for the holiday. So, and again, as of this morning, of those 50 COVID positive patients that were in the acute medical center, only 10 of them were in the ICU. And I think 7 of them were on a mechanical ventilator. So again, that's also welcome news. At the same time, we continue to be incredibly busy, though, as a medical center. Actually at 100% occupancy when you count the patients that we're holding in the emergency department waiting for a bed to open up. As of early this morning, we did not have a single open bed in our 21-bed medical ICU. So we had 10 COVID patients that were in the ICU, but the other 11 beds were full of non-COVID patients requiring intensive care. And we only had 4 of our 20 cardiac ICU beds were available. So of our 41 total intensive care beds across the medical center, only 5 of them were open. So we do continue to be very, very busy. We had 322 of our 344 adult beds were occupied, so that's a 93.4% occupancy rate. But then again, if you add those 23 patients that were in the emergency department, a physician had already made a decision that they needed to be admitted, but there was not a bed open for them yet. So when you count them in with those other 322, we had 345 patients and 344 beds. So literally at that 100% occupancy. Since the beginning of the pandemic, I know this is something that's always been of great interest. We've now had just slightly more than 1,600 of our employees have contracted the COVID virus. 39 of our providers, physicians, and advanced practice providers. But I'm delighted to report that only 24 of our employees are out on a COVID leave of absence. Only 7 of them that were from 2020. So those that are out right now have been more current infections. None of our providers are out on a COVID-related leave right now. So, and I suspect it has a lot to do with our increasing vaccination rate. 98% of our medical staff, our physicians and our advanced practice providers are fully vaccinated, and we're now up to 82% of our employees are fully vaccinated. So that's good news. I'll contrast that with our county. I don't know if that's a question today, but seems quite relevant at this point in our discussion today. Is that at the county level, and so there's roughly 484,000 people countywide, and we know now that virtually the entire population is eligible to receive a vaccination, including children as young as 5 years old. The adolescent dose of the Pfizer vaccine now available for school school-age children. But as of today, the county is reporting that only 46.1% of our entire countywide population is fully vaccinated. We do have another 6.4% that are partially vaccinated, which means they either had the Pfizer or Moderna vaccine and they've only received that first shot. And so hopefully they follow through and get that second shot. That 6.4% would then be added to the 46.1 fully vaccinated, and we'd cross over that 50% threshold. So we'd be at 52.5%, so a little over half of our countywide population fully vaccinated, but still unfortunately leaving a way too high percentage of our population unvaccinated, which is why we continue to have one of the highest COVID hospitalization rates throughout the state, because we do have, unfortunately, we're not the worst in the state. We don't have the lowest countywide vaccination rate, but we definitely are there in the top 10. So, and I think that's it for the numbers.
All right, so there were conflicting reports, and a community member wanted to know, are we recommending getting the booster that is the same vaccine that we received, or are we now recommending to get another booster? If we got Pfizer, should we get Moderna for our booster?
Right. So we do know at this point that the FDA and the CDC have approved mix and match vaccination, and have approved mix and match of boosters. Quia Health as an organization is not making a recommendation of any sort other than really to follow the guidance and the recommendations of the manufacturer. I have read frequently that those that receive the single dose of Johnson & Johnson, they definitely can receive a booster shot of Johnson & Johnson. But I have seen, I don't know if I'd call it a recommendation, but I've certainly seen evidence suggesting that those folks should really consider getting a Moderna or Pfizer booster shot. So mixing their Johnson & Johnson with one of the mRNA vaccines has proven that if you get Johnson & Johnson and then get a booster of Johnson & Johnson, it does elevate your immunity level, but not as high as your booster being the Moderna or Pfizer. So I have heard that. I really haven't seen much. If you got the Pfizer vaccine, you were definitely, in fact, I think maybe you were required. If Pfizer was your first shot, you had to get Pfizer as your second shot, and same with Moderna. But now you can get either one. So I think all of us in the room here got the Pfizer vaccination, so the 2-shot, 3 weeks apart. But we could get the Pfizer as a booster, or we could get the Moderna. But I haven't really heard a recommendation or any real indication that one, increases your immunity over another. I think most people that I've talked to are continuing to follow that if I got Pfizer, I'm going to get Pfizer as my booster. If I got Moderna, I'm going to get Moderna as my booster. But we're not making any recommendations. Our medical staff, our pharmacy and therapeutics committee has not made any recommendation.
Okay. Yeah. Well, and I wonder if you were to get a different brand, if you would have different side effects. I had the same side effects with all three. Nothing.
Yeah, and I really haven't. Did you? But you got
I had
all.
nothing. Yeah, I had Pfizer, and it was the same.
But you got
all
Pfizer,
3 times.
Pfizer.
Pfizer.
Yeah. So I got Pfizer. I have an appointment to get my booster on December 21st. I selected Pfizer. I didn't have any reaction to either of the two as well.
You could try, just so we would have a tester.
Yeah. My wife got the Moderna, and she had a pretty strong reaction.
Okay.
Particularly to the second shot. But I've heard the same thing of people that got the Pfizer. So.
But you've said the stronger the reaction, the better, right?
Yeah, and maybe the fact that I contracted COVID in mid-September.
And she didn't.
And she didn't. Yeah, she got her vaccine, I think, in April. But she was there with me side by side through my whole quarantine. She got tested twice during my 10 days, and no, yeah, she avoided it. So maybe that says something
Very
for Moderna.
interesting. Yeah.
I'm not certain.
Yeah. So a lot of people on this call are concerned about Cahuilla Health financially. And so one of the questions that was asked was about whether or not we've expanded our elective surgeries. When we shut it down,
Right.
it hurts us financially. So where are we at on opening up our surgeries?
Yeah, and I'll just reaffirm what you said. Elective inpatient surgery is really kind of the lifeblood for most hospitals, acute medical centers, and we're no exception to that. During non-pandemic times, we generally perform about 15 elective inpatient surgeries per day. That's along with trauma and emergency and emergent surgeries. And so, yeah, having to shut down or tamp down elective inpatient surgeries certainly has a negative financial impact on the organization, but it also has an impact on our community, our patients. Because if you're suffering from a shoulder injury or you need that knee or hip replaced, it's not emergency, so you'd fall into that elective inpatient. But that doesn't take away your pain. It doesn't go on a vacation while we close that down. And so, we are very sensitive to that. And that's really, I won't deny that the financial impact and wanting to get back to normal capacity is important, but it's also important for taking care of our community. So when the Delta variant arrived in August, we did almost immediately tamp down our daily capacity to only 3 elective inpatients. And so that did have a devastating financial impact in August and September and carried into October. We then, this last month, we increased that slightly up to 5 per day. And then just about a week and a half ago, with the COVID census dropping and still very, very busy, obviously at 100% occupancy, but working with our surgery leaders and our staff, we felt comfortable raising it to 8 per day. So 8 cases per day is kind of the max. No limit on outpatient surgery or procedure, no limit on emergency or highly urgent, but 8 per day, Monday through Friday, which is still, again, only about half of what we would normally expect to do. So hopefully the numbers continue to go in the right direction. I will tell you that we are going to hold our breath over the next couple weeks because it generally, every surge that we've experienced throughout this pandemic has generally followed a holiday, particularly a holiday where we traditionally have big gatherings like 4th of July, Christmas, Thanksgiving. We didn't have a vaccine last Thanksgiving, so we're hoping that our experience this year will be vastly different. But we also know that people kind of shut down and isolated more last Thanksgiving than they did this Thanksgiving. So we'll know in 2 or 3 weeks whether the Delta variant has continued to subside and people, either through vaccination or having contracted COVID and having natural antibodies, definitely hoping that that's the case and the numbers continue to decline and we can continue to ramp up surgery.
So, opening surgery back up, numbers going down. What about our visitors policy?
Yeah, throughout the entire course of the pandemic, and I know we almost routinely talk about it during these discussions, as we've tightened and loosened our visitation policy, continuously throughout the pandemic, and we continuously meet to evaluate, what are the conditions on the ground, always looking first for patient safety, staff safety, and visitor safety. And so in August, because of the Delta variant and really the second biggest surge that we felt throughout this entire pandemic, we definitely had to really kind of tighten up. We just had a meeting yesterday, all of our section chiefs, about, okay, can we loosen up, particularly patients that have COVID. So those the policy has been COVID-infected patients generally cannot have any visitors. We make rare exceptions when it really is end of life, and that's gut-wrenching, that a patient that is going to pass away from COVID cannot have their family at their side. Mm-hmm. So we've been looking at very carefully over this last week and a half, trying to determine, okay, how do we safely allow visitors to be with COVID positive patients? So the first thing we think is, okay, how about those that are in the ICU, where they're more gravely ill with COVID? Can we allow them to have an all-day visitor? And some hospitals are allowing that if that visitor is fully vaccinated and is still all donned in the PPE, using an N95 mask and a shield and everything. So some hospitals are allowing that. Others are still not allowing any visitation to COVID positive patients. So we're looking at that very carefully. Also, our policy has been for non-COVID patients that you can have one visitor, but it has to be the same visitor throughout that patient's entire stay. So we're looking to maybe shortly change that, where we could switch out visitors during the stay and potentially even during the same day, and even in certain cases maybe allowing 2 visitors for that non-COVID patient. So all of that's under consideration right now. And it definitely is affected or influenced by the number of COVID patients that we have in-house, but it's also influenced by just our overall occupancy. So again, being 100% full, it's very difficult to accommodate a lot of visitors when you're at full occupancy and your staff are still stretched very thin. But our staff are the first to say, even those in the ICU taking care of COVID patients, they want visitors. They know that visitors help with communication. Mm-hmm. They help, if a patient is intubated or is having, to be restrained in some way to not harm themselves, having a visitor there, a loved one to comfort them, is probably the best medicine that we could provide. So communication, healing, reducing anxiety, all of the benefits of visitation, and those all carefully go into our thought process. And we want to be patient-centric. We want to be, passion is our mission. That's our promise, compassion, and so, that's going to be an overriding influence here, but at the same time, safety as well.
Mm-hmm. Yeah, that's a tough one. It's kind of like when they kept kids out of school, it's like, okay, safety versus socialization and the outcomes of that,
Right.
Very sad.
Yes.
Very sad. And it would be interesting to know if any reports have been done on patient outcomes based on visitors, visitors.
I haven't heard. I'm certain there's been studies done about the effect on children, the isolation, and unfortunately, I've heard it's all been very, very negative. And but I haven't seen any studies on the absence of visitation during the pandemic and what effect that's had on patients and staff. And but that would be interesting.
Tough calls to make. Yeah. So this new variant, even the word variant.
Right.
When it hit the news, I was just like, oh my goodness. So we've seen it.
Omicron.
It's here.
Omicron.
Not
Omicron.
Omicron.
Yes, Omicron. It's a Greek letter. You may know early on in the pandemic, we used to refer to the variant based on the country that it was first discovered in. But we kind of abandoned that approach and started assigning Greek letters to it. So Delta variant, we've had Alpha, Beta, Lambda, Mu, Delta, and now Omicron. So Omicron has been classified by the World Health Organization as a variant of concern. So it is the 13th variant of concern that has been declared or designated as such by the World Health Organization since the beginning of the pandemic. I read just the other day that the variant, the original SARS-CoV-2 variant, has now mutated close to 100 times. But they're subtle mutations, and so they're definitely picked up by the genome sequencing process, as was the Omicron variant. But of those 100 mutations, only 13 rose to the level of a variant of concern. So, yes, appropriately titled, we are concerned. We know so little about it. We just heard yesterday or day before that the first case of Omicron was detected in the United States in San Francisco, here in California. We understand that that person was fully vaccinated and is experiencing only mild symptoms of it. So I hope that that means that the virus, or excuse me, the vaccine is still effective in preventing a variant of any kind from causing us to become severely ill, hospitalized, or die. And that's always been, the objective of the vaccine. So it might be a rallying cry to get our boosters with this new variant. I think people, fully believe that the current vaccines will continue to be effective against other variants. They tend to have the same properties. This Omicron variant, though, I think has a unique property that is the way they were able to actually detect it in the genome sequencing. Maybe it's going to cause it to be more elusive and avoid the antibodies that are created by the vaccine. But I think time will only tell. I think what reports out of South Africa have indicated that while it seems to be highly transmissible and is making its way rapidly through South Africa, and I think it's been detected in 14 other countries now, but by all indications it seems to be pretty mild. So that's the case here, but again, vaccination is still, I think, the leading prevention, approach to staying healthy and to minimizing. Again, it's not going to prevent you from getting infected, but I think and I know by personal experience that it's highly effective at keeping somebody from getting very ill and keeping them out of the hospital.
So are we testing for that variant here, or is that county?
We can't. Our county can. Our county laboratory does, the Tulare County Department of Public Health does have the ability to do genome sequential or sequencing. And so we, throughout this Delta surge, we send every positive specimen to the county to do the sequencing. And it was through that we learned that essentially 100% of our COVID-infected patients were infected with the Delta variant. So I would imagine, will continue to send every positive specimen to the county, and the county will then inform us if any of our patients tested positive for the Omicron variant.
Okay. So we talk about the numbers dropping. We get excited about the numbers dropping, but that's one of the variables to that is death. And so have we been experiencing a lot of death in our hospital?
Yeah, sadly we have. Death is the trailing metric of COVID. I mean, obviously the positivity rate, as we test people who may exhibit symptoms, and that's the first thing we learn, that they're positive, and then generally within 2 to 3 weeks, they might at that point are requiring hospitalization, and then 2 to 3 weeks after that is where we might experience a death. So throughout this surge, we have unfortunately, sadly, seen quite a bit of death. I think it was just a few weeks ago when we were reporting here, I think it was on that day that Tulare County reported that they had just experienced their 1,000th COVID-related death. So I think I have some information on that. Yes. So last week, the week November 25th to December 2nd, we had 7 COVID-related, where COVID was their primary diagnosis. We do get, many patients are admitted for things really unrelated to COVID. They might have suffered a heart attack or a stroke, although that could be triggered by COVID. But they're admitted for congestive heart failure or pneumonia or other things. But they test positive for COVID at the same time. We classify those as COVID as a secondary diagnosis. So contrary to what some people have commented out there in social media, there is no benefit whatsoever in the hospital classifying a patient as COVID. We don't, get paid a huge sum of money for that. If they're COVID positive and that's their primary diagnosis, I think Medicare does pay us $2,000 more for that, but that patient stays 2 to 3 times longer, and the resources that go into it. And so we absolutely would love 0 COVID patients if that was a possibility. But this last week ending December 2nd, we had 7 primary COVID deaths. The week before that, we had 17. As the COVID inpatient population has been declining, we have seen the number of deaths week over week has come down. But again, I don't know, since the beginning of August, the arrival of the Delta variant, I don't know what our cumulative deaths have been during that time period. For the most part, COVID patients are passing away in hospitals. Not at home, not in nursing homes. They generally, when they start becoming hypoxic and their oxygen saturation starts falling, they're having great difficult breathing, they're almost always brought in by ambulance. And despite all the heroic efforts of our physicians and nurses, we simply have not been able to claim victory over this virus.
So what about the MAB, or the monoclonal antibody treatment?
Right, like bamlivimab, and what's the new one? Molnupiravir. That's one of the. Oh no, molnupiravir. That's the Merck antiviral pill that we're hoping comes on the market.
That hasn't been approved yet, right?
Hasn't been approved. The FDA just this week, on a narrow vote, I think it was like 15 to 13, the advisory committee gave approval or support to the Merck antiviral pill. So as it turns out, it's not quite as effective at preventing hospitalization and death as originally believed. They thought it would be as effective as 50%, but now it looks like it's more like 30%. And so I don't know if it's actually going to pass formal FDA approval. We're going to have to wait and see. Pfizer also has its antiviral pill that they're claiming to have an effective rate of 80 to 85% of preventing serious illness or death. So they're second in line moving through the FDA process. So
So is this a pill? If you were positive for COVID, you would take this pill?
Yes.
After positivity?
Yes.
Okay.
Yes. It'll be interesting, can it be taken prophylactically? Which means you don't have COVID. You've not contracted it, but you're going to take it to prevent it. We heard of people that were taking hydroxychloroquine as a preventative measure. We do talk about, people keep your immune systems boosted. Take vitamin D and zinc and take a multivitamin, take vitamin C. Do those to help prevent you from contracting the virus by keeping your immune system, really elevated. So we'll wait and see. The monoclonal antibodies, MAB, a lot easier to say that, have been around for a while. We've been giving those both intravenously and subcutaneously. Is that the right word, Daniel? Yeah, subcutaneous. So under the skin, in the muscle. So we do both. The subcutaneous is done by injection, and you get 4 injections when you go, 1 in each arm and 1 in each cheek, not your face. So we're doing both of those. Unfortunately, it hasn't been as well utilized as we hoped. I think what some of the information I got. So Quia Health has been offering at our infusion center over on the corner of Willis and Ben Maddox. We were doing it every Tuesday, and we were seeing roughly 5 to 8 patients a day. When we had the capability of doing more than 100, but we're only seeing 5 to 8 a day. And then Quia Health Medical Group, who owns and operates the Sequoia Prompt Care walk-in clinic over on Ben Maddox and Tulare, they were doing MAB infusions on Saturdays. And they also were seeing only about 3 to 7 patients. So again, clearly not as many as we'd hoped. And then our ED started actually doing it. Patients that would come in as COVID positive, didn't need to be admitted, so they weren't severe enough. We were going to discharge home, and we were offering the MAB therapy while they were in the ED, but we've only done about 12 of those patients. So yeah, it's definitely
Is there a time frame though, Gary? Like, do you have to catch it
Yes, you do.
before hospitalization?
Yes.
Okay.
Yeah. Some of them are within 5 days, others are within 10 days. So MAB, I know that when I contracted the virus in mid-September, I actually spoke to Dr. Bruce Hall, who's the medical director of the Quia Health Medical Group, and they were doing the MAB therapies that coming Saturday, and I go, what do you think? Should I get it? And he said, well, it sounds like you're doing very well. You're already vaccinated, and you can really receive this monoclonal antibody up to 10 days after the onset of symptoms. And so why don't we, let's watch, wait and see. And I felt really that, that monoclonal antibody treatment is really designed for the unvaccinated. That it's too late for them to get vaccinated. So this is the first line of treatment for somebody that is at higher risk of getting severely ill. So I was comfortable, waiting, and as it turns out, it was just fine. I think I did read that the Merck antiviral pill, that it has to be taken within the first 5 days of the onset of symptoms. So you got to, just make certain that you're fitting within that window. And again, contact your primary care physician to get the MAB therapy. All we need is an order from your physician, and we can then administer the therapy at that point. So it's pretty easy to receive it.
Yeah, so they just need to call. And do you think we're not doing very many people because the word isn't out? I mean, I know Quia Health, we, put the word out about it, but...
I don't know. I'd just be speculating. Yeah, I mean, we pretty much were reaching out to the medical community, to the primary care physician offices, and making them aware of the MAB treatment therapy that we had available, and when it was available, where, what days, the hours, and everything. And we just didn't see a real high utilization of it. I was on the section chief call yesterday. There was a lot of discussion that in the month of December, working with the county, to really try to increase exposure, awareness, and utilization of it as well.
Okay. All right, Gary. Well, we have answered all of the submitted questions. So,
Wow.
yeah, and we even had a chat we took care of. So,
Oh, did we?
unless
Okay,
you
all
have
right.
something else you want to announce, we can give our viewers some time.
Okay. Again, thank you for being here. I happen to be out, and I don't know if this gentleman is on our telecast today, but I was out rounding at the Kauai Health Medical Group or Visalia Medical Clinic on Tuesday, and just happened to bump into a patient that stopped me and recognized me and said, "Hey, Gary, I want to thank you for your biweekly telecasts with the community. You are my single source of information, and I really appreciate you being out there and sharing information with us and answering us questions, and that made my day."
Yeah,
I mean, I just really thank you. I mean, that's kind of been, our goal through all of this is to really have a highly informed community, and particularly all of you, our community ambassadors and our community advisory group members. So thank you for tuning in all the time. Thank you for your great questions. I hope all of you had a happy and thankful Thanksgiving. We're very thankful for you and your commitment and dedication and support of our Kauai Health organization and our staff and providers. So I think I'll see you before we break for Christmas. But for those that aren't able to make it, I just wish you a very happy holiday season, and be safe. Enjoy your family, but take care of yourself. So thank you and have a great day.